Good morning, everybody. It's nice to be here, and thank you for the invitation. After listening to Dr. Mary Jo Kreitzer outline the model and all of the things that were involved in the integration from her world, I'm going to take it now into a microscopic issue and talk about chiropractic specifically. I'm going to talk about this chiropractic dilemma, where we were, where we are, and hopefully where we will be. I want to set this historical stage by letting you know that it wasn't too long ago that healthcare professions which weren't controlled completely by the AMA would be opposed and ultimately scheduled to be eliminated, believe it or not. But this is how I see and perceive the historical progress of the healthcare integration from 1950 to 2020. And that is, back in the 50s, more doctors smoked Camels than any other cigarette. And you could buy cigarettes at your bedside in the 50s, if you can believe it. And so I'm here, I'm probably going to be the one to talk about this gigantic elephant in the room called chiropractic. So are we talking about integration of chiropractic? Is it real, or is it just kind of wishful thinking on our part? So for those of you who don't know, in 1975, the chiropractic profession was forced to litigate against the American Medical Association. After a decade and a half of almost containing and eliminating the profession, 5 chiropractors sued the American Medical Association, American Hospital Association, Joint Commission on Accreditation, and all of the groups essentially that were conspiring. So Dr. Kreitzer talked about the education, and from her vantage point at the University of Minnesota, which is phenomenal. But essentially, back then, the AMA's position was chiropractors were uneducated, and therefore they shouldn't be qualified to practice. So when the chiropractic educational institutions decided to hire MDs and PhDs to teach at our institutions, like C.W. Post and Moorhead State College, those individuals received a letter from the AMA saying, if you teach at a chiropractic college, you'll never teach any place again. So on one hand, they wanted to call us uneducated, and on the other hand, they wanted to prevent us from getting qualified instructors. So essentially, this is a tale about the AMA, their lobbyists, and the close connections that they had in order to stifle and ultimately eliminate the chiropractic. So I lived through one of the models that Mary Jo didn't talk about, and that was the O model. I'd be in a meeting or an event, someone would say, this is Dr. Sportelli, and they'd say, what kind of a doctor are you? I'd say, I'm a chiropractor. And they'd say, oh. And so I became the O doctor. So a lot has changed since then. And I guess the changes are the integration and advances, and it depends on what your definition of integration is. But here's a few examples of the chiropractic integration model currently utilized in various settings, like the VA and private hospitals and universities, and we'll go all the way down to the University of Pittsburgh and Osher as we advance to the slides. And so here's one that basically kind of struck me, and that was in 2005, 15 years ago, that essentially half of the physicians, 48%, believed the chiropractors would be effective. 29% indicated that they were ineffective, and 57% reported that, massage therapy could be effective. Not a lot has changed in terms of the mindset, even in 2020, but it's not impressive at all. So we could talk about the current integration of the practice settings by various examples, by ownership, by facility, and by focus. Now, most comprehensive, obviously, public model is the VA. Phenomenal operation. 16 VA facilities across the country, affiliated with 10 chiropractic schools. Over 600 chiropractic students have taken advantage of the opportunity to go through the VA for training. And it obviously is the largest direct healthcare system in the United States. And the model is improving and changing every single day, thank you. The innovative model, obviously, is the private hospital acquisition model, and very unusual, visionary, largely because the people running the hospitals are usually MBAs now and not MDs. And so they're preparing for this inevitable end of the fee-for-service. They're recognizing the value-based care, and they're recognizing this paradigm shift in utilizing the most conservative care first, and particularly non-pharmacological approaches to back pain versus the first approach, which is normally surgery or physiatry. So the model it occurred in the Lehigh Valley, and it was the Lehigh Valley Hospital Center. And 50 years ago, this would have been a pipe dream. And today, the chiropractors are actually employees of the facility. There are now 10 DCs on the hospital physician employment, and the chiropractors are essentially a division of the Department of Medicine within the framework of the hospital. And then you have the Duke University model, which is the multidisciplinary collaborative care for non-operative spine care, or as they affectionately call it, the MC squared spine model. And it's based on evidence-based guidelines that recommend conservative approaches for the spine. They all basically say the same thing. Let's use the most conservative approach first. And this innovative models like the MC2 spine care at Duke are going to ultimately demonstrate better outcomes at lower costs. And it's important that stakeholders are increasingly committed to the national efforts focused on implementation because of the value-based care delivery models. And then you have the Missouri Orthopedic Institute, which is a spine-centered model only. And chiropractic is involved in that non-operative spine aspect of that. And the chiropractors are assistant professors in the University of Missouri School of Medicine, Department of Orthopedic Surgery, and Physical Medicine and Rehab. So they're integrated into the system in a very specific and narrow way. And then you have the academic university model, which is the University of Pittsburgh School of Health and Rehabilitation Science. And at that university, we're talking about a research and education model as well as a clinical practice model. And there's two chiropractors who are there with full-time research faculty within the School of Health and Rehabilitative Sciences. And the one chiropractor who's a full-time clinical practice is Dr. Schneier, and then there's Dr. Stevens. They have also recently submitted a proposal for a new chiropractic degree program to be offered at the University of Pittsburgh. And if and when that should occur, that would be the first chiropractic educational program to be offered by a research-intensive university in the United States. Very, very, very interesting model. And then we have Osher. And Osher was started through the philanthropic grant from Bernard Osher. And essentially, the program was focused on developing and educating medical practitioners. And Dr. Eisenberg was a consultant to that Harvard Medical School in 2020. And that site became interesting because the medical school students were exposed to chiropractors, naturopaths, acupuncturists, and so forth. Currently, the Osher Center has become a site for several medical clinician researchers to co-locate. One example, wonderful example, is the headache model, which Dr. Carolyn Bernstein, who's a neurologist, had a keen interest in chiropractic, and her example is in the impact pilot study on migraine headaches and their management. This has led to 5 papers, either in production or prepared for publication. And most impressive is a proposal to fund the postdoctorate fellowship for a doctor of chiropractic to further connect the clinical research and educational initiatives at Osher under direction of Dr. Peter Wayne and Dr. Matthew Kowalski. That has recently been approved, and it's just starting. So we've come a long way. From 1950, smoking was in, chiropractors were out. In 2020, smoking is out, chiropractors are in. So integration within the framework of the chiropractic world, we've certainly come a long way. And thank you for the opportunity. I look forward to the panel discussion.